for tuning in to Wellness again today on a very calm Saturday. We appreciate God for the gift of life. And I want to appreciate everyone that has also logged on to be a part of this webinar. It promises to be exciting because we're going to be treating a topic that virtually all of us know about. And sometimes we believe that because people are old, they have to go through those circumstances. And that's what we're going to talk about, dementia. My dad, my late dad used to say that it's good to be old, but the rebe. And I think that rebe is part of it is dementia because the helplessness that you see in people and it calls for concerns sometimes. So today I still remain Adetutu Afolabi. I'm a pharmacist by training. I'm an emotional coach, and I'm the MD of Wellness Healthcare Group. And this webinar is brought to you by Wellness as usual. This is one of the ways in which we're reaching out to everyone and also improving the well-being of the people. By this monthly webinar, we've been able to get a lot of testimonies of people that have been able to change how they live their lives just because they want to live longer and they want to live better. Don't forget that your body does not forgive. And that's why we're doing this webinar so that where you need to enjoy your body is not asking you to pay back by sicknesses and diseases. That's one of the very reasons why we're doing this. So wellness, we have our wellness HMO where we give seamless access to our enrollees to access care, pay little and enjoy more. That's what wellness HMO is all about. Wellness health insurance, and for our Wellness Plus app, you can go on our Wellness Plus app and book your medical checkup, your optical checkup, your eye checkup, so that you can feel good with yourselves. Especially when we know that most diseases are better discovered at their early stage so that the people can actually live longer even though they have them. Oh, today I'm not going to be doing this alone. I'm going to be doing it with Dr. Adegoke Benjamin. He's a consultant psychiatrist at Ekiti State University Teaching Hospital. He's also a researcher, and he had his first degree at Ladoke Akitola University of Technology, Ogumosho, Oyo State. He has a master in pharmacology, so he's going to be a very hot doctor because pharmacology is one of the things that makes us as pharmacists even feel good with ourselves. And of course, he started his psychiatry training at Obafemi Awolowo Ile-Ife, University Ile-Ife School of Medicine. So he's going to be with us today. Dr. Adegoke, can you say shout out to to friends and
Yeah,
family?
good morning, our audience. It's nice to be on stage today to discuss this peculiar and very interesting topic. You are all welcome on board. Thank you. Also appreciate the CEO of Awareness and all the Awareness organization altogether for giving me this platform. I appreciate you all. Thank you.
Thank you, Dr. Adegoke. Please don't forget to share the link with friends and family. Don't be the only person that will listen to this. And also don't forget to subscribe to our YouTube page. Subscribe so that you can get notification on anything that we're doing on that space. And also don't forget to follow us on our social media pages, wellness_care. So this is wellness. Bring it to you a very fine topic. Dr. Adegoke, so a lot of people are wondering how to take care of their children. And I also have parents that are in their 60s wondering, will there be people to take care of them when they are old? Because especially in this era of Jakpa, where children are before children are in the city, parents are in the village, and people still go to the village to see them. But it's becoming a more serious problem in Nigeria where people are also afraid to go to the village. And so I believe that this might be a long term process, and people in their 40s should be getting ready, 50s should be getting ready to being able to take care of themselves. And that's one of the reasons why we're treating this, because the best thing that can happen to anyone is to grow old and grow old in good health. And that's why we are having this as well. And also for people on this timeline to be able to know what to do when they have parents or they have loved ones that are going through dementia. So, Dr. Adegoke, so I'm going to start for you to tell us what dementia is. What is dementia?
Thank you very much. Yeah, like you said, in this kind of environment we find ourselves now, it needs to understand the reasons why we need to understand dementias and how to take care of ourselves as we are getting older. Dementia can be looked into and defined as a condition in which there is impairment in memory and other cognitive aspects of an individual. Meanwhile, the consciousness of the person is still intact. So that is a simple way to explain it. And when we mean about cognitive functioning, we talked about individual that has we have no we claim memory, intelligence, ability to learn things, getting around with functions around us. All these things are impaired in individuals who have a dementia. Like I always said earlier said, the conscious aspect of life is still intact, unlike other conditions where they may be in coma, that is delirium or other conditions. When dementia, the person is aware of his environment, only does that he lost memory of recent more than the past events. Thank you.
Thank you, Dr. Adegoke. So you said that it's a condition that the person is conscious, but the person has lost, an impairment in his memory. And also, the person might not be
Yes.
able to perform some cognitive functions. The person might not be able to learn. The person might not be able to do active listening. The person is there, is conscious of his environment, is aware this person is in front of him, but he might not be able to relate as much with that person. Is that
Yes,
what
that's
they
what
meant?
we that is what all is all about. You get it right. So the individuals lost concentration, attention, ability to do judgments is impaired, and their social abilities are also affected. All sorts of things, but the person is conscious. He's
Person
not
is
in a he's not in a coma.
that's serious.
Yes.
So are there different types of dementia? Can you just give us the
Yes.
different and what makes each one peculiar to the other in simple languages so that people can
Yes,
understand?
because I understand my audience are not, most of them are not doctors, they are social environment, some of them are engineers. I would like to break it down in a simpler form. When we talk about dementia is a brick, is an umbrella that has many aspects. Aspects in terms of the types that is related to dementia. One of the common one we have is Alzheimer's dementia. Is the most commonest form of dementia and is very common among females more than male. Follow this one is the vascular dementia. Vascular dementia is lesser in prevalence compared to Alzheimer's. And we can also have another form called the mixed dementia, in which it can combine with Alzheimer's and vascular coming together. Another one that is getting prominent now is the Lewy body dementia, and also we have a frontotemporal dementia and others. The list is endless. Let me know the others. It can be due to infection like HIV induced dementia. It can be due to injury, trauma to the head that can cause this. It can also be the hormonal imbalance like thyroid functions disorders. Some of them can precipitate dementias. So the list is endless, but in this discussion, let's just focus on three or four major ones. We know the Alzheimer's dementia, which is general, and also we also talked about the vascular dementia and the Lewy body dementia and frontotemporal dementia. Just we can focus on that one so that those ones can be a link to address other ones. The symptoms and signs are almost the same thing. Symptoms, the problems they have are almost the same thing. The cause may be different, and even the treatment is almost in the same approach. Thank you.
Thank you, Doctor. I know that for a lot of us, the thing about the truth about dementia came to life when one of our veteran actor, Mr. Olu Jacobs, the wife told us that he had dementia, and a lot of people had to look into it, and that was when some people actually realized that whatever was happening to their older ones or grandparents was actually dementia, and it wasn't old age. So I'm going to ask you about, is it old age? Does is the dementia synonymous to old age? That's one. And is it, should people be said, is it okay in old age? Is it okay to have dementia because you are old?
Yes. Yeah. There is a lot of misperceptions that are wrong about dementia. Is in this kind of platform, I see it as an advantage to let our audience know that dementia is different from being an being in old age. Yes, as one gets older, some of the activities one perform at the youthful part of life are diminished in old age. However, dementia itself is a disease entity which is not linked to aging, even though it occurs more in people who are of the extremes of age. But I need to let us know also that people who are in the younger age group are now having dementia too. People before the age of 65 are also coming down with dementia based upon any of the etiologies or the causes or types I mentioned earlier. Also, let us understand that because I'm getting older is synonymous that somebody's going to get down with dementia. No, it's preventable. And the natural parts of aging doesn't need to be dementia. Also believes that one will not live longer when somebody have dementia. No, there are series of reports, cases that individuals even live longer whenever they have dementia. It depends on some of the things we are going to talk about in this our discussion and presentation. Does it mean that when somebody gets dementia, it's going to be aggressive? Doesn't necessarily need to be aggressive. It depends on how we approach it. We shall discuss these ones as we go ahead in this our discussion. We no longer understand or what is happening around them. No, like I said earlier on, they are conscious, but
Conscious.
because of the challenges they face, kind of support they have, they become aggressive. They lost the kind of taste they feel about themselves. They need to be treated with dignity and respect. So some of the things we've seen in them is that getting older doesn't mean it's going to have a dementia. It depends on the discussion we're going to have today, how we take care of ourselves now. Thank you.
Now, so dementia is not synonymous to old age, and old age is
It's
not
not
synonymous to dementia. Dementia is a
exactly.
disease state, and so
Yes.
when we have older people in our folks getting old and they are having dementia, we should not categorize that it's because they are old. Yes, it
Hmm.
occurs in most older people, and now we've been seeing cases of people that are lesser than 65 already coming down with dementia. I watched a movie and I couldn't finish the movie. She was a professor of English and she started having dementia in her 50s. It was crazy. I couldn't complete it because I saw the state of helplessness and I'm like, really, this is terrible. So viewers, see, dementia is not synonymous to old age. And today we're going to talk about how do we take care of ourselves now so that by the time we get to that old age, we're not coming down with dementia and some of those things. Yes, we should do our best. Remember, one of the things that we're saying on this platform is we should take care of ourselves so that we don't have to spend our lifetime taking care of any disease. Thank you very much. So it's not synonymous. Thank you. Okay, so Dr. Adegoke, so what are the causes of dementia? What are the causes?
Yes. Before I mention the causes, I first of all let us understand that classification of dementia could be due to age. Like we said, before age of 65, this than age of 65. Part of the cause can be also due to the part of the brain that's been affected. Some of my terminologies here may look a little bit, but I will try to break it down. It can be cortical or subcortical, that is the part of the brain that we see outside and some under the brain. And sometimes it's reversible. It can be reversible and some of them are not reversible. So when we are talking about dementia, we let our patients, caregivers know that we do our best, but the earlier the better. So now going to the question of what are the causes of dementia? Yes, the causes of dementia are enormous. They are so wide that we can't exhaust it today, but we try our best. One, trauma, head injury. It has been found that trauma to the head can be a cause of dementia. Two, we also found out that individuals who have a family history of either parents or relatives that have a dementia, this has tendency of coming down with dementia. And also, Infections, like I mentioned earlier on, HIV, some other forms, SLE, systemic erythematosus. Some of these conditions can predispose individual to have this condition we are having. Also, thyroid abnormalities can be a cause. And most common one that we tend to neglect, depression, can lead an individual to come down with these kind of conditions we are having. Also, some comorbid conditions like schizophrenia, also use of medications that are not well used enough can be a cause of this. Alcohol can trigger individual coming down with a dementia. The
Wow.
list is endless like that. So I just enjoy us to continue with this. We still continue to mention more and more as we feel like so our audience will not be lost with all these our terminologies. Thank you.
Hey, thank you, Dr. Adegoke. So we know that head injury could cause anything. I remember when we were small and we love to somersault. My mom is usually saying that when if you hit your head, you can become schizophrenic, and I think that's the major part that she's afraid of. So there was a time I somersault and my head hit the tiles in the house. I didn't tell anybody. I was just asking myself, hey God,
Well,
am I not going to go
it,
sick now? And I kept that in
not
a
every
lot.
injury comes out with dementia. I just want to
No,
know that
no,
one,
I,
but
I was
it's
just telling
linked
you
to it.
what I went through that time. I was expecting myself to start tearing my dress. I was small. I was like, hey, Oluwa, Motigbe, how will I tell this woman this is what happened? Thank God for God mercies on children. Thank God for God
Thank
mercies.
God.
So you said something about family history. Some of us we might see this in
Yes.
our grandparents, really. And
Yes.
it's a pointer for us to begin to listen so that we
Be
can know how
careful.
we can
Yes.
prevent dementia. It could be due to infections as well. You said depression, which is very common these days. People should seek help. There are signs. I think we'll treat depression on this platform one of these days, so that people can know, because a lot of us are very unhappy with what is happening in Nigeria, and you might not know when you just cross that line. You might not know. It takes someone looking at you actively sometimes to know that you have crossed the line. We're going to talk about depression. Okay, so alcohol can predispose people to alcohol is good only in some few quantities. So everybody knows
Yes.
that. Everybody knows
With,
that. So
with
be a
moderation.
conscious,
Yes.
yes, be a conscious drinker, a moderate drinker. Okay, so what are the symptoms of dementia, Doctor Adegoke?
Yes. Thank you. The symptoms of dementias, like we mentioned the other time, to start with, the dementia is like a spectrum from the mild to moderate and severe. So in the early stage, the individuals will tend to forget recent events, but they will not know. Unlike in pseudo dementia, that the individual will be one complaining of it, is a family member that we know. And at times, they tend to lose the task, activities they are used to do before. Also, they lose calculations. You might give them some money, they don't know ordinary simple arithmetics about those money. Sometimes they misplace objects and they will be emphatic about where they place it, where they place it. For example, a woman of 76-year-old puts her phone under her pillow and she was checking the sitting room for her phone handset until one of the family members located the place and gave it to her. So they will be, and sometimes they'll be accusing other people wrongly that they are taking their property. Meanwhile, they are misplacing their property. One of the other things is that they lost locations. Sometimes a elderly woman of 65 went to church. On her way coming back, she doesn't know her way back home again. So they lose information of their whereabouts. And as the procedure gets worse, they might start even lost the names of close people nearer to them. For example, a man that has been he's not of late now. He's been a chairman of many boards in the government establishments. Lost the idea or memory that she, at a point in time, being a board chairman. A very important information. Somebody who lose the idea that they are married with their husband. They lost the name of their children. So that's one of the features that we see. They have disorientation in time and place. and also they lack challenges. They lost the poor judgment. Somebody just cook food and forgot that he cooked food, put the food inside the refrigerator. So these are some of the features that we've seen in them, and it depends on the stage of presentations to the memory clinic. Thank you. And
So,
like we said earlier on, to just to add this to it, that the protective factors or the risk factors of some of these things is common among the low education. So when you see in the memory clinic, you find that people with low educational attainment come down with all these features I earlier mentioned. Somebody who has a maybe cerebrovascular injury like hypertensive heart disease, diabetes, so also come down with this common problem. And also the like I said earlier on, and you also mentioned history of depression can also make some of these features more worsened. So the progression depends on other comorbidities, whether it's going to be slow or it's going to be faster. Thank you.
thank you, Dr. Adegoke. So the major part of this dementia is that forgetfulness of recent events. Will they be able
Yes.
to talk about things that, like someone in his 90s start telling us things in the 1925, 50s and all that? Will they be able to do that?
Yes.
They will be able to do that.
Exactly.
So
You
they
are
can
right.
tell history.
They tell you history. What happened when they were in Ghana at the age of 25? They will tell you some of the friends they met. But because you were not in that picture as a child, you will think the man is saying rubbish. So recent events got lost quickly than remote events. Eventually, as disease gets progressing, all those remote long-term events are also getting wiped off away gradually. So they started with the recent one and later on to the remote
It
one.
progresses.
So
Oh,
so that the pictures normally seen in them. So you'll be surprised that they came for a wedding 2 weeks ago. They forgot they went for a wedding, but they will remember the wedding they had at a particular location in Lagos in 1925, in 1950, and they can give you detailed information. Some of the friends they met in those events than what they did 2 weeks ago or last week. Thank
so
you.
they will be is so we should get close to them and they will tell us stories.
Yes,
Don't
we
be
talked about that
hungry
one
and
when
they can't
when it comes to
remember this.
treatment. Yes,
So one has to
we
get
need
close to them so they can tell stories of what has happened in the
we need to
recent.
get
Oh,
yes, we need to get closer. They need a lot of social support.
social
And
support.
you mentioned something the other time that this kind of age we have when children japa, let's use that term, the japa is in go to other part of the continent for greener pasture, leaving the parents behind, worsening this dementia we are talking about. The care we're supposed to give our elderly ones, and some of our when we get there, we talk about it actually needs a social support system. In short,
Okay, so what are the tests people should do to detect
yes.
dementia? Because right now we have cancer screening tests that people could do to detect early signs of cancer. Please, if you are listening to me, go on Wellness Plus app and do your cancer screening test. It's just blood, and at least we've been able to identify up to like eight cancers, eight common cancers, and just by doing some test on the blood, one can know that if the person is predisposed or if the person has signs of those cancers. So earlier discovery of some of these events can help do maybe it's reversible now. One will just reverse it and all that. So what are the tests that people can do to detect if they have dementia or if they will be predisposed to it?
Yes, thank you very much. Like we all know, infections, diseases, they come unexpected. However, in kind of like dementia, we can't really say this is a particular pattern is going to come with for an individual. No malaria, we know fever, we come in vomiting, all those things. It's a progress, gently smaller in a smaller bit. So individuals need the support, like I said, we need to get across to individuals. It individual will not know himself. It is the people nearer to him that we tend to say to know that something is going wrong with this man or this woman. So when it comes to memory clinic, what we normally do is do a baseline investigation when an information is that the person is forgetting recent events. He cannot dress on his own very well. He cannot do normal activities normally do before. Because there are, like I said, there are many causes that have it. So you can do just underlying basic investigations like full blood counts. You want to know there's any infections. Here you are creatinine. You want to know that the balance, the electrolyte balance is well. Some of them can lead to confusion. So we want to remove possibly cause of all these things. Thyroid function test, because hyperthyroidism or hypothyroidism can present in this kind of fashion like well. Also, it depends. Also, we can go further to do CT or MRI imaging of the brain to look out for some pathological features like amyloid deposits, neurotransmitter tangles in the brain. So that's some of the things we can do. However, the diagnostic materials that can sometimes be used is known as a mini mental state examination. This is common in this environment. There are others that can use. So by the time you conduct this examination for an individual, the score, when the Lord score is less than 20, then you can be sure that the dementia has taken place. So it's not a difficult test. As you are getting older, just create a time. Come to this memory clinic or to the hospital, come and conduct just a cognitive assessment for yourself. And when you do it, possibly we'll now do some baseline investigations to rule out possible cause of it. And most of the time, all these tests are most especially negative because Alzheimer's or dementia cause are always found inside the brain. You cannot see them visibly in the bloodstream like that. Thank you.
Okay, so Dr. Adegoke, what yes, if people want to come to memory clinic, are they supposed to come when they now feel they are forgetting things, or they should come like, I'm okay, I'm not forgetting anything, I'm doing very well right now, just to come and check?
Yeah, like assessments or regular checkup is a mandatory thing nowadays because information is abounding. There are lots of informations going around. So it's not a bad thing if a 50-year-old, a 20-year, a 50, a 70-year-old man approach a clinic and come and conduct this psychological assessment. So you don't need to wait till when you retired or when the family member starts noticing all these problems before you come for assessments. Just walk in and assess yourself. So by that time, you can easily identify and arrest the progression as early as possible. Thank you.
Thank you. Especially because we know that dementia is not just caused by old age. There could be some other things, electrolyte imbalance and all that. So
Yes.
memory clinics. So do all psychiatric
Vitamin
hospitals have
deficiencies.
memory clinic? Do all
Yes.
psychiatric hospitals?
In the current dispensations, I can confirmly say that we have psychiatrists in our environment, like in Lagos, almost the big cities in Nigeria. And you can always walk to any of the psychiatric facilities to conduct assessments for yourself. If you feel like, at least I'm getting older, I need to check my brain activities. So some of these things, doing 5 to 10 minutes is true, and you can really assess. And by the time you do it on a regular basis, at least once in 6 months, it's further could help individual to know if there are any deficits in cognition. Thank
Wow.
you.
Thank you very much. So we've already answered some of these questions. So people should go for cognitive assessment in a memory clinic, and I think I like that. Sure, I like it. So is dementia preventable? And what can be done
Yes.
by people below 65 years of age? If you're on this timeline and you have questions to ask, please drop the questions and the team will send it to us. We want to also add to the questions that has been earlier sent. So please drop the questions so that we can also add it to this. Should in case while we're discussing this, you realize that there is a question that you need to ask. So is dementia preventable? And what can be done by
Yes.
people below 65 years of age, or maybe people below 50, because the movie I watched, the woman was 55. So maybe people below 55 or 65, what can be done?
Thank you very much. Like I said earlier on, it's preventable. However, some of them are genetic. They would like to express themselves, like Alzheimer's disease. They are preventable. So, when there is a family history of Alzheimer's or dementia, the individual can start as early as possible to involve himself in a cognitive activities. Like I always tell my patients, the tendency for individual to come down with dementia is lower for individuals who have good academic attainment. It's
Mhm.
common to people who have low academic attainment. So the more you challenge your brain, put it into use, the earlier the better. Anything that can cause injury to the brain or insult to the brain, those are the things we need to reduce. And also, there are use of medications like NSAIDs, which is actually aspirin, have also been found to be also good in preventing or to reduce the risk of individual coming down with dementia. Also, it will also provide the treatment of comorbidities, infections, depression as early as possible could prevent coming down with individual coming down with a dementia. Similarly, we also found out that individuals who have a good social support,
Hmm.
families are nearer, children are nearer, they go to gatherings that enhances them to perform, contribute their cognitive ways, can also help them to contribute very, very well. For example, you find yourself in an estate whereby people gist, you are not left alone, then you can talk that this person is tendency for this person to come to dementia is lower compared to the person who keep to himself alone in the house alone,
Left
not
alone.
going for social functioning, not for religious functioning. So those are the things we need to consider. Thank you. Thank you.
Okay, thank you very much. I know I read something about if you're above 40, one of the things you need to do is to work on your cognitive activities. People that do not stop to learn are likely not to come down with dementia, like people that stop learning, especially when people retires and believe there is nothing to do again. So when people retires and they are taking another course and they are going for workshops and all that, it should be encouraged. Socially, we should be relevant. To prevent dementia, we should be relevant. Go for functions, relate with friends and family. I know that when my mom, I brought her to my house, she's always complaining she's going back to her house where people can just drop off and say hello to her, rather than staying in an estate where nobody knows her. Being in an estate and not relating with your friend, with people around you could be problematic. So we're social animals, and we need to be socially interested. Yes, treatment of comorbidity, depressions, and all that. So people have these things, they need to work on it and make sure that they are treated. Injury to the brain, there are some of those things that one might not be able to prevent if someone has an accident and all that. But one should look into it. Then when someone has family history, then once you know your grandma or your grandpa had dementia, just start reading. Just start reading and become a professor on time.
Yes.
Apart from the other things that one might not be able to prevent, because there are so many things that still happens and nobody knows why. But for some of us, we can actually actively prevent dementia. Thank you very much. I think
Okay.
I'm happy. I'm happy one can do it. So, are there medications that slows down the progression of the disease once the person is diagnosed? Are there
Yes.
medications that the person can take and it will slow it down?
Yes. As soon as the diagnosis is being made and it's confirmed that individual has dementia, like I said, there are different types. The most common one is Alzheimer's disease, which is common among females than male. And also one is a vascular dementia, which is common in male than female, and they can be mixed together. So the treatments can be pharmacological, use of medications. And the most common medication we have here are the anticholinergic medications, anticholinesterase. So in this environment, we normally prescribe donepezil, sometimes known as Aricept, in the management of dementia. I would just want us to know one thing for sure is that this condition is not curable, because I like to make my my client, my patients understand that this condition is not that we are trying to cure it, but we tend to treat the symptoms and to lower the progressions of this condition, dementia. So this will further assist them to live a very good life, and possibly a good quality of life, so that they can enjoy themselves where they are still alive. And the main reason for this medication is just also to help them to be able to reduce their aggression. So, like I said, donepezil is one of the drugs that we normally prescribe for individuals with dementia. Also, rivastigmine, which also known as Exelon or galantamine, Reminine can also be used for them. Those drugs are not common drugs. It's only for people who have been to the memory clinic that we know. Also, because some of them come down with vascular dementia, and vascular dementia has to do with individual that has a cardiovascular problem, maybe stroke or diabetes or systemic hypertension. Use of medications to treat the underlying cause go a long way to further assist them to recover and to reduce this worsening of the conditions over time. Also, people with Lewy body dementia benefit from the drugs I earlier mentioned. And however, sometimes you see them with aggression, with agitation. So the place of use of antipsychotics, which especially the atypical ones like risperidone, is not a bad idea at all. Sometimes they come with depressive features. Use of antidepressants like serotonin reuptake inhibitors could also be of very good use, like fluoxetine have been found to be very effective. And sometimes they come with anxiety, because
Mm,
sometimes they find themselves in the locations and they feel threatening, that where am I
mm,
here? Sometimes,
mm.
and if you have some prominent features of poor sleep, anxiety features, restlessness, you might give them anxiolytics as well to further help them in those kind of areas. So, however, use of drugs like vitamins to enhance their vitamin could also be like vitamin E, has also been found to be very effective in them. I came across some drugs which I also found but not common in these environments. The ginkgo biloba is a herbal drugs found used in the Asia countries. Have been found
Yes.
to be very effective in people with behavioral or dementic diseases. And these are some of the things we need to look into, apart from some non-pharmacological um, treatment and modalities that can be effective or assistant to our patients who have dementic features. I think that one should be enough for now. Or should go for
When,
that.
when, you- when you when you listen to a pharmacologist, you know that he will be telling you all those cholinergic
And
properties of
very
drugs. Yes, 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 yes. I can say it's true that a pharmacologist. Yes, thank you very much. So there are drugs that people can take that slows down the progression of this, and just like every other illnesses like hypertension and diabetes, there is no cure, but people can actually take medications to reduce the progression and still make them feel good and live life to the fullest without any worry. So there are medications. The best thing is for it to be identified on time, and when it's identified on time, drug commencement can work. So can you tell us about the non-pharmacological way of taking care of dementia? I know that one of the things you said is people still learning and all that, but social functions and all that to prevent. But people that already having dementia, what kind of support that is not drugs, so that people are not just saying, "I've given it," you are taking care of someone and you're saying you have given the person the drug, and you feel that's all that is required. What are the non-pharmacological way of taking care of people with dementia?
Yeah, thank you very much. As we talked about the pharmacological, we also have non-pharmacological approach that can be helped to lessen the problems they are facing. One of the things we found out that we need a good social support and modification of lifestyle. To start with that, if an individual is staying in a duplex or in the upstairs, it's not a bad idea if the person is staying somewhere lower, because there is a effect that we know as sundowning effect, which is about worsening of these symptoms when it's dark. So let's make sure that the environment is more conducive to accidents and injury. So staying in the upstairs, you might need to relocate them to a downstairs. Two, making sure that the environment is conducive with use of maybe rug than use of tiles that might cause slippery and lead to injury that can even worsen their conditions and treatments. It's not a good bad idea also if labeling of the rooms, like this is a kitchen, this is toilet, this is bedroom, so that some of them, by the time they read, who are literate enough, when they read some of these things, we not go and defecate in the sitting room or defecate in the kitchen. They know where to go by the leading all those things. So we might need to tag each room for them. Two, we might need to get a caregiver who might need to stay with them and knowledgeable so that and that person may not be the person who is abusing the elderly, because nowadays we find that people now use CCTV cameras so as to checkmate the effect of those caregivers we have around them. And one of the specific ones that have been known to be very effective is the bright light therapy, making sure that the environments are well lighted, make sure that the environment has enough light, and at night make sure that they have enough, maybe a torchlight, a lamp that can guide them and reduce the agitation and worsening of the confusions they might be having. Talking therapy is also a good one. The children, and they start from now, should know how to talk to their parents in a way that reduce aggressions and confusions in them. So individual with dementia benefit a lot when they have informations like this, talking to them, like psychotherapy sessions, family member coming and visit all the time, remembering them of good old times, times events, helping them to coordinate their lifestyle. Also, we have a massage. You can do some massage for them so that can further help them. Pet therapy, all these things are common in the developed country, but sometimes too we find that some of them are also being used in the environment among the literates. And also we can get some pet for them, taking care of chicken, dogs around in the house, can also assist them, communicate with all these things, can also help them to come from their boredoms and start interacting. The other one is the reminiscence therapy. That is about remembering the good old days. I remember when we were young, we always keep albums, but now we find that albums, picture albums, are now of lower. Um, it's not so common again. Like
Yeah,
what we
we're
find
not.
out in the 80s or 70s, people go with their phones alone or putting things on the cloud, on the email, or all those storage facilities. So get a good photo frame as we visit them, explain to them, look at Sade. Was 7 year old in 1977, and now Sade is now a big girl now, married, staying in California with his family. Show them pictures that of good things that keep them alive. With those pictures, interacting with them, they will not think that Sade is not existing again. They know that Sade is already somewhere. And when Sade comes to visit them in Nigeria, they will quickly understand that this is Sade that I battled for. I took care of her when she was in primary school, secondary school, before she left to another continent. So those are the things we need to put in place. Some of these things will further assist them to do better and to cope with the relatives and reduce the aggression and shows that they are being loved, they are being treated with dignity and respect. Another one is the music therapy. You find that when you conduct, maybe you play some of those old time music for them, maybe Ebenezer Obey, Sonny Ade, they used to in the 70s, in the 60s, they come alive again. They are cheerful, the anxiety, depression in them, some boredom in them goes away. When you encourage them to go, some of them they can't go to these Pentecostal churches. They like going to all these Orthodox churches where they play
They can
hymns,
sing psalms.
psalms.
They says they
Those
can
are the
sing
songs they
hymns.
like to go. But when they go to all these charismatic Pentecostal or all those environments, they find themselves lost among the youth. So they need music therapy. I will tell my the family members that are close to them that look for one of these transistor radios that has memory card. Get this music for them, listen to this music. Whenever there are no music, tune to local radios where they speak in Yoruba or in the language they understand very well. Let them listen to those Yoruba news or the Hausa
Lost
news in their
language.
dialect. so that they feel like, wow, I still in this environment. Not that they just lost touch. Some of them don't understand what is happening in CNN or in the channels or all these TVC news. But when they listen to all these common things, they listen to all those dramas, it goes a long way to further boost out their morale and feel that, wow, my children loves me, they respect me, they give they're able to talk to me better. I feel loved. So those are things we can do to further assist them with the combination of the medications we are giving to them. Because if you give medication to somebody that is not showing love, they may not take those medications. So the combination of the two together goes a long way to assist in treatment of individual with this condition. I think I am able to address that. Thank you.
Thank you very much. I think this non-pharmacological support is very, very important. It's not enough to give them the medication. It's not enough to make sure they meet their doctor's appointment. But having creating an environment for them that is well lit, and that does not expose them to so much accidents or to accidents at all. You know, you said that people should use rug instead of towels, people should have the
Yes.
environment well lit, people should label the rooms, and of course having a caregiver that will understand that is there to stimulate their cognitive abilities by discussing with them, asking questions. And for friends and family, you're going there to help them remember the old good days. You are not bothered about the things that are happening now because you know that they do not really have, they couldn't hold the memory of recent activities. So you help them to discuss what happened in the past and they are happy discussing it. Then you talked about music therapy, you talk about pet therapy. I know that some people also have to go and some people allow them to grow with their grandchildren, and that helps them to sometimes I see old men even calling their grandchildren their son's name because they cannot remember
Yes.
the name of that grandchildren that you keep telling them, but they can remember their son
Hmm.
that is already in his 60s. So they just keep calling that grandchild that looks like that son, even though it's not even the son or the grandchild of that person, and they just keep calling that person. So most importantly, we need to show love. It's not enough to give medication, and we need to learn to do a lot of talking therapy that does not aggravate their confusions and their aggression. So yes, you don't like the fact that they're aggressive. They're going through a lot. That's why they're aggressive. And for us, we need to now see how we can step it down and make them feel good while we're discussing with them. And I think discussing with them will also expose us to some of those stories that we might never hear except they tell us, because they remember those old good days and they can tell us about it. Thank you, doctor. So so
Thank
um
you.
now we know that people should not be left alone when they have dementia. The support system is very important. They can't be left alone. They can't be left in, you can't say that the guy can take care of himself. And even if you give caregivers, they need to be supervised. You need to be a part of it because most times caregivers are not families. They need family support. And I know that it's going to be a lot of work right now because of the era and hate that we have. And most of us are not with our parents. So I would also want to ask a question. What type of specialist should people with dementia see? Is it just the psychiatrist all the time for their dementia, or there are other specialists they have to see for their dementia?
Thank you. Because of to get holistic and a very good attention, it's better to see a geriatric psychiatrist. And luckily for us, in this environment, especially in the southwest Nigeria, I can confidently say that we have many geriatric psychiatrists in our tertiary centers who can further assist individuals with this problem. However, coming down to hospital as earlier enough is good so that some of the mild symptoms can be addressed. But as condition gets worse, the outcome will not be too good enough. So the earlier the better we approach the facilities nearest to us, who can direct the individual that having this problem to a geriatric psychiatrist could be to be a very good benefit for those people and for the family. Thank you.
Thank you. So a geriatric psychiatrist, not just psychiatrist now, not just a consultant psychiatrist, a psychiatrist that is specialized in taking care of older
The old
patients.
old age.
Yes, those are the people that you should see. Okay, so there is a question that someone asked: what's the best place for care? Should it still be home or nursing facility?
Yes, what you generally know is that caring for this for individual with dementia is much better to be in a facility that is conducive for them. However, if an individual is having a very extreme or very difficult conditions, maybe a comorbid condition, maybe he's having hypertension, diabetes, or a trauma to any part of the body, is a good advantage to bring that person to the hospital where those things are treated. However, long stay in the hospital is not beneficial to them because they lose touch with the environment they came from. So we normally look at issue like not more than 2 weeks in the hospital stay so that they go back to their home or to environment where they come from so that they don't lose touch with those environments and the treatment can go there. So they can all be coming for outpatient clinic. So like I just say it, the best way of treating them is closer to the caregiver, maybe in their home. But I also want to mention that in developed countries, there is a old old people's home, which is not common in this environment. And if you look at that idea, some people have started coming with it. I know some places in some western part of Nigeria here where they are thinking about old people's home. SUS can also help in caring for individuals who have these kind of conditions we are talking about. Thank you.
Oh, thank you, Dr. Adegoke. So, whether home or nursing facility, the most important thing is an environment that is conducive and the person can be closer to his doctor as well, where people will show love, where people will care. If we can create those environments at home where that person is used to, is still the best, so that they do not lose touch of who they are or who they've always been, and it can help them to, I think, their memory and their cognitive abilities. So whichever way, what is important is that the pharmacology and the non-pharmacological support is very important in a conducive environment close to the caregivers so that they can actually take care of those persons. Thank you, Dr. Adegoke.
Thank you.
Thank you for having us. Thank you for this webinar. For me, I've learned a lot. I've learned the fact
It's a
that
privilege.
dementia is a condition that has to do with impairment in memory and cognitive functions, but with the person not losing consciousness. So the person is aware of his environment, but the person might not be able to do a lot of things, give the right judgments, give the right contribution, and it starts with losing of memory of recent events, while the person still keeps the remote events in their heads intact, and they can discuss it appropriately. We talked about the four common types of dementia, which is Alzheimer, which is vascular, mixed, and Lewy body dementia, and of course we know that. It's dementia is not synonymous to old age. Yes, it's most common in old age, but it doesn't mean that it is synonymous to old age. It's a disease, so you don't have to be forgetful when you are old. Yes, you might not be able to remember so many things, but when you're not remembering recent things, if the person has just eaten and the person does not remember that he has eaten, that's a very recent event, then there is a problem. So we should not say that the person has just is old. Yes, that person actually requires needs to see a medical needs to see maybe a geriatric psychiatrist immediately. We also said that now we have reports to show that people below 65 years old are already coming down with dementia. Yes, age is the most common factor of dementia. Then we have family history, we have head injury, we have people that have thyroid abnormalities. They can come down with depression and dementia, even depression. Alcohol in not moderate amounts can also lead to depression. The most common symptoms of depression is the fact that people forget recent activities and they are not able to contribute to whatever is happening in the environment as much as they can because of the cognitive functions that is lost. We said that now people should try to go to memory clinic. Yes, visit memory clinic in psychiatric hospitals and check your cognitive functions and do a cognitive assessment to be able to for you to know that that's the best test now that we can do to detect if there is an early onset or late set of dementia. And we also said that there are some genetic causes, especially when it comes to Alzheimer diseases. Yes, family history. You said that one of the ways to prevent dementia also is for people to be open to learning, to be using their brain actively. Whether you have retired or you're about retiring, keep your brain working. Read, to take courses, just make sure that your brain is doing a lot of things. Be actively involved in social functions. Don't stay alone. Don't be alone. Be interested in your environment. If you are on the streets, relate to the people around your street. Go to parties, relate with people. Those are the ways to prevent dementia when we're old. So, and we have to do it now. If you're in your 40s, you're in 50s, you need to begin to make sure that you're socially connected, especially people that are planning to retire. Don't retire and sit alone at home. Yes, there are drugs that can help to slow down the progression of dementia. There is no cure for dementia, but if someone is on medication, the person can be well taken care of, and the progression is slowed down, and the person can still live a normal life. And most importantly, the non-pharmacological way of taking care of dementia is very important. The social support, the caregivers, they have to be nice. And you talked about music therapy. You even said that those people love to go to if they're Christians, they love to go to the churches they were going to, yes, when they were younger, where they sing psalms and hymns and all those things. And when they are listening to news, don't let us bother them with CNN. Just put them in a channel or in a radio station that speaks their first language. Yes, the news and the channel, speaks their first language. It allows them to function appropriately. You talked about bright light therapy. Wherever they stay should be well lit. We should do talking therapy with them. Yes, they can do pet therapy. And when we visit them, we need to discuss the old good times with them and make them feel good and feel alive again. Yes, you talked about if they are staying in a room, we should bring them downstairs and don't let them stay upstairs again. Bring them downstairs, change the tiles to rugs, and just make sure that wherever they are is not prone to accidents. I think I've covered all, and the best specialist they need to see is being logged out. I wanted him to say some few words to us, but I think the network has failed where he is. Thank you for being a part of this, Dr. Adegoke. We appreciate you. Don't forget to share this webinar with friends and family. We all need to be able to take care of our older people, and we also need to prepare to take care of ourselves so that when we get there, we're not a burden to people around us. So thank you very much. I think he's back. Thank you, viewers. Don't forget to share this with friends and family. Share the link with them. Let them also listen to it. And don't forget to follow our social media pages, wellness_care. We love you and want you to be a part of the next webinar. Dr. Adekeke, what will you tell our audience? Dr. Adekeke, do you have any to tell our audience?
Hello, I lost you some
Yes,
few minutes
you want
ago.
to tell our audience anything? Closing
It's a
remark.
pleasure being on this platform. Thank you for having me. Thank you so much. I'll see more of you or more invitation next time. Thank you.
Yes, thank you very much, Dr. Adekeke. And thank you for everyone. Let's go and enjoy our weekend and see you next month. Thank you very much. Bye.